Okay, hi folks. Thanks for fitting in. This session is only an hour, so it's a bit shorter. So in the interest or respect for our speakers, I'm just going to get started. Though I recognize people will trickle in, and that's part of the joy of conferences. My name is Chris Uejio. I'm a HAQAST member, but you really don't need to hear much from me. I'm going to really focus on the speakers. This session's in examining environmental exposures and health inequities. EE Hi. Our first speaker, Qian Xiao, who's also an HAQAST member.
Hello, thanks for the introduction. Good afternoon, everyone. I'll see how I do this. Okay. So to open up this session, I'm going to give you an overview about our Tiger team, which is called SD4EJ, which stands for the Satellite Data for Environmental Justice. First, a quick definition of environmental justice taken from the EPA website. Environmental justice is the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. Slightly long, but pretty comprehensive definition. And these are some of the objectives that I consider as important for environmental justice research and practice. It's by no means an exhaustive list, just what I think when I think about this field. Those important objectives include the understanding and monitoring of disparate patterns of environmental exposures across different populations, understanding the consequences of exposure disparities. So for example, if some communities have higher exposure, does that translate into health disparities? Identifying vulnerable communities and identifying underlying causes of the disparate exposure patterns. With that, leading to the development of interventions and the evaluation of interventions to address those problems, and also include important objectives such as public education and community engagement. So the reason that we want satellite data for environmental justice is because there are unique advantages of satellite data. I think the important one is actually the second bullet point here is because they have a wide and continuous geographic coverage. And this is especially important when you are in areas with limited ground monitoring, and that's usually areas where disadvantaged communities live. And also there is a high spatial resolution, and it's being improved by the day, which is also very important for EJ research and practice. So there is a growing need for satellite data by EJ organizations. They need data, they need analytic tools, visualization tools, and they need platforms for the exchange of resources and ideas, all of which are what we are trying to do as part of this Tiger team. So what is Tiger team? You probably have already heard this a few times this morning. And this is the official definition of the Tiger team from HAQAST. It's a short-term, high-impact collaborative effort. Very important, it's collaborative, and the collaboration is between HAQAST members and public stakeholders to identify and solve and immediate problem using NASA data and products. And I have the website link here for the Tiger teams. This is the second round of the Tiger team. And in the first round, we also have a SD4EJ Tiger team. And those are the dates for those two Tiger teams. The first round was led by Susan Annenberg and myself. And I want to give you a very quick recap of our achievements in that first round. We engaged a diverse group of partners and stakeholders. We held monthly meetings registered by over 150 people from academic institutions, governmental organizations, NGOs, industries, and think tanks. And we had a series of diverse presentations by researchers and stakeholders. We integrated satellite data into several EJ mapping tools, increased accessibility to satellite data for EJ applications by building a website, by writing a how-to document, and by working with NASA to do an RSET training on environmental justice, which happened in August this year. And we also wrote this review paper to foster environmental justice research by evaluating and synthesizing the current literature on this topic. So now, with the second round, here are some objectives for this Tiger team. The overarching objective is to build capacity among environmental justice communities for applying satellite data to advance EJ agendas. There are three main objectives. The first is to facilitate the communication and collaboration between stakeholders and researchers. We will continue to have our monthly meetings. And we also have a forum. So the HAQAST forum, we have built a sort of a subpage for our Tiger team. And we will continue to build resources to provide data and tools for environmental justice research and practice by updating our website. So when new data and the tools become available, we're going to include that in our website. And we're going to provide data and technical support to fulfill specific needs of stakeholders by doing collaborative projects with stakeholders. And I'll give you a few examples later. So monthly meetings is held the first Wednesday of every month. And the first one was in September, so we had two now. And it's open to everyone on our mailing list. If you are interested, please come talk to me. I can add you to the mailing list, and you will get emails from us inviting you to join the monthly meetings. In those meetings, the aim is to facilitate the exchange of ideas and resources and build collaborations. We hold broad discussions on various aspects related to environmental justice. We have presentations. Again, usually we have 2 or 3 of them from both researchers and stakeholders. Collaborative projects is a big focus of this round of Tiger team. So in the first round, we did start a few collaborative projects, but we view our first round more as a learning process, a hearing process, just to know about the needs. And now we feel we're a little bit more ready to actually collaborate with stakeholders and provide data and technical support. So I'm going to talk about 3 projects very briefly as examples. So the first one is this Chinatown project, and the collaborator or stakeholder here is EDF, Environmental Defense Fund. The focus here is on air, light, and noise pollution in Chinatown, in Manhattan, New York City. The main issues is that with some field study, the EDF found that the local residents in that area, they're very concerned about various pollution sources. However, there's limited ground monitoring. As I mentioned, this is where satellite data become important. So the objective is to provide granular data and visualization tools to sort of characterizing the exposure patterns to address the concerns of community members. This is a project that's initiated by EDF. They already did their groundwork. They came to us, one of the HAQAST members, and I believe it's Daniel Tong, and he mentioned this to me, so I got connected to the EDF and had a few meetings with the program director of this project and trying to facilitate and connect her with the right people with the data and tools that she needs. And another example of the things that we have been doing in collaboration with is this review paper. The collaborator here is the CDC Environmental Justice Index team. So they developed the Environmental Justice Index. And I had discussions with them. First, we were not even talking about Tiger team, just trying to understand their process of developing this index, some barriers, some challenges. And one of the things they mentioned is that this notion of the exposure to multiple pollutants. So when disadvantaged communities are exposed to environmental adversities, it's usually not just one adversity, it's a whole host of adversities. And also those are socially disadvantaged neighborhoods which we have a hypothesis, and many other researchers have investigated that, is that social disadvantage can actually exacerbate the adversities of physical exposures, right? So when you think about, let's say, light pollution is what I study, not only disadvantaged communities are exposed to higher levels of light pollution, but when they are exposed to light, they are more vulnerable. They're more likely to develop health problems due to light because they don't have blackout curtains, because they have more stress. They may have less healthy sleep habits, or they work for irregular hours, and they are more likely to be impacted by light pollution compared to a person living in affluent neighborhoods. So the focus of this review paper is really to assess the current research landscape, focusing on the interaction between social disadvantage and physical exposure. And to provide evidence that the EJ index team can take into consideration in their development and the refining of their EJ index. And the final example I'm going to give you is this light at night in Chicago. You saw those figures from Tracy's presentation this morning. And the stakeholder collaborator here is the Adler Planetarium in Chicago. So this is also a very interesting collaboration where they have already been doing a lot of community engagement work in Chicago in low-income communities. They had high school students doing a photo voice project. So they take pictures of their neighborhood. They had a little exhibition in the local museum, talk about light pollution in their communities. And I heard a talk from a person from Adler in this light at night conference in Canada. And I connected with them, and they were interested in satellite data as another way to quantify the problem, and also to showcase the disparities of light pollution in their communities. And but they didn't have the manpower or the statistical expertise and time to do the analysis. So I said I can do that. So that's a result of those two figures. On the left, you have the light at night figure. It's census tract. So each little pixel is a census tract, not pixel, I mean each little block of color. And the second, down the right side, you have social vulnerability, which is the social vulnerability index, also developed by CDC. And you can kind of see the mirroring pattern here, but the take-home message is that the neighborhoods with higher levels of social vulnerability are also the neighborhoods have higher levels of light pollution. So we're doing some follow-up analysis, really focusing on certain neighborhoods, but this is the type of collaborative project that that can develop in this Tiger team. So to end this talk, if you are a stakeholder or researcher, if you're interested in environmental justice work, or you have a need for satellite data or the tools, come talk to me. Maybe we can have some other examples resulting from the talk. That's all.
Thank you very much. What a wonderful orientation to this session. Our next speaker is Maeve MacMurdo from the Cleveland Clinic. As previous sessions, we'll hold our questions till the end.
Hey, Chris, feel free to cut me off if I'm over, because I could talk about this for a long time. So yeah, you can just shout at me, it's okay. So as Chris mentioned, my name is Maeve MacMurdo. I'm an occupational environmental pulmonologist at the Cleveland Clinic, and my work really focuses on understanding the impact of air pollution as a health disparity and as an occupational exposure. I could talk about this for a long time. I promise I'm not going to. I'm going to keep it at 10 minutes. And really the main goals from today are to try to really convey how air pollution acts as a driver of health disparities, give you a highlight of Cleveland and our problems, of which we have, unfortunately, many, and then give you some case studies of how we have used satellite data at the community level to really understand and advance environmental justice. So I want to start off by really highlighting that air pollution is an environmental injustice issue. We know that under the Clean Air Act, overall PM2.5 exposure has gone down, but that decrease has not been equal. In non-white majority neighborhoods, we still see a higher level of exposure to PM2.5, to nitrogen dioxide, to carbon dioxide, and particularly in areas impacted by historic redlining, there is a significant disparity in how much air pollution exposure is experienced. It's not just these criteria pollutants. We think about where TRI facilities are placed, where industrial facilities are placed. These are almost all placed in historically redlined and disadvantaged communities. And these are a major driver of exposure to air pollutants, exposure to things that increase the risk of respiratory disease, cardiovascular disease, morbidity, and mortality. When we look at health outcomes, again, everyone knows air pollution is bad for you. That really is at this point common sense, though we still need studies. But the reality is that the mortality caused by PM2.5 is not equal. Again, Black and brown communities disproportionately bear the mortality from air pollution exposure. And so while environmental justice is huge, it's multifactorial, air pollution is a significant and unmodifiable risk that contributes to a lot of the mortality we see in these communities. It's also complicated. Again, it's not just PM2.5. We focus a lot on monitoring and measuring PM2.5, but the reality is it really is a multiplicative and complicated exposure where this co-exposure to nitrogen dioxide, to PM2.5, to the hazardous air pollutants all combine and really act in combination to increase the risk of cardiovascular, respiratory, morbidity, and mortality. And again, driven from multiple sources. So I want to talk about Cleveland. And many of you may know Cleveland because our river caught fire, rather famously in the 1970s, leading to the passage of the Clean Water Act. But Cleveland has a long history of environmental exposures that have driven poor air quality. We have an active steel mill still running in downtown Cleveland. We have an oil refinery. We have a huge industrial process. And while Cleveland's patterns have shifted, we still aren't doing very well. The ALA State of the Air report ranked Cleveland 25 in cities for the worst air quality in the United States. We are frequently in non-attainment for ozone. And again, still have a large steel mill running in downtown Cleveland, which is active. We also have significant traffic-related air pollution, a significant industry. And again, looking at where that industry is, we know that we have 1,400 TRIs in the city of Cleveland. Of those, all but one is in a historically redlined community. And so really, again, this exposure is not equal. The other challenge, though, is this exposure is not well understood. This is a map basically breaking down the neighborhoods in Cleveland by their EJ score quintile. And we don't do great. We're mostly red. But what you can see is those 4 black dots are the areas of continuous PM2.5 monitoring. And what you'll see pretty obviously is that for a large part of Cleveland, we really don't have a great sense of what the PM2.5 exposure actually is, which is important because PM2.5 varies at the block by block, street by street level. And we know that the exposure drivers are really in these historically redlined communities. So with just continuous monitor data, we're really not capturing the full picture of exposure. I want to change tack a little bit here and talk about something that came in the earlier sessions about how we can think about kind of air pollution exposure in the personal level and how we can use satellite data to really understand that better. And one group that I've focused on a lot is individuals experiencing homelessness. So unfortunately, in the United States, homelessness is increasing, particularly unsheltered homelessness. And what that means is sleeping basically outside, typically on the street, in an area that's not fit for human habitation. We know that people who experience homelessness are already at increased risk of dying of respiratory disease, primarily lung cancer, infectious disease. And while part of that risk is driven by smoking, it's not all driven by smoking. Air pollution exposure is another potentially major driver that's not well recognized or not well understood. Because again, thinking about how we map exposure and how we think about sort of big public health outcomes, people who are homeless don't have a home address. So in the EMR and the medical record, their outcomes aren't being captured in the same way. They can't be tracked. But people who are homeless worry about air quality. One small study out of Utah looked at how people perceived air quality who are homeless and found that most, 9 out of 10, were worried about air quality, felt that their breathing was worse because of air quality, but couldn't do anything about it. So we worked with Tulare County, which is a small rural county in inland California. and has actually the highest rate of unsheltered homelessness per capita in the country. So a significant population of unsheltered homelessness. Unfortunately, Tulare County is also at high risk for air pollution exposure. They have a heavy agricultural population. They've got a lot of industry, a lot of traffic, and now a lot of wildfires. So really, it's the perfect storm in terms of PM2.5 exposure. They also only have one monitor for the entire county, which means that it's very, very hard to know what the exposure actually is. Like I talked about, a lot of the challenges with actually thinking about exposure outcomes and monitoring of people who experience homelessness is that by definition, they don't have a home address. There's no way of figuring out where they're exposed. To try and get around that, we basically partner with Tulare County, and during their magnet events, they have an annual census every year where basically everyone who's homeless in the country comes in and gets surveyed and accesses healthcare resources. We got people to map out where they slept, where they spent time, where they kind of considered to be their home base throughout the day, and then use that data to basically create an activity space polygon, an area where they might be exposed and experience exposure, and then use satellite data combined with data from the county to really map out both where the exposure sources were and then the actual PM2.5 people were experiencing throughout their day in that activity space. What we found was that really traffic-related air pollution was a major driver of exposure potentially. Roughly half our participants were sleeping or spending time during the day within 300 feet of a major roadway. And thinking about where is safe, where you can sleep safely at night, people were commonly sleeping in places that were basically TRIs or stationary emitters because they were private, people weren't going in there. So people were going into parking lots and sleeping by those facilities. We saw that annual exposure to PM2.5 was consistently higher than the air quality standard, though it varied by location, but ranging between 14 to 16 micrograms per meter squared, which is significantly above the national air quality standard and probably has significant health impacts. What's important about this, and why I think it's important to think about this really at the community level, is we can do something about this. And really what this data told us was that thinking about intervention and thinking about making a health impact, what really mattered was getting people into housing. Because if you're in a house, by definition, you're no longer unsheltered, you're no longer experiencing outdoor air pollution. And so this really supported Tulare County's push for basically housing first initiatives to get people into housing and then work on everything else after that. It also supports, again, thinking about not just one exposure source, but really multiple exposure sources. And again, thinking about air pollution exposure as not just traffic, as not just wildfires, but really the whole picture of exposure. I'm going to change tack here a little bit and talk about something we're working on currently. So as I mentioned, the city of Cleveland has a long history of health disparities, of air pollution disparities. And while things are changing in the city of Cleveland, mostly for the better, there are still things which are not quite so great. So one of those things is the Opportunity Corridor, which is a major roadway that was built through historically Black neighborhoods throughout the city of Cleveland and opened approximately 2 years ago. This has significantly changed traffic patterns in the area, has brought business, but also significant car volume and traffic-related air pollution to these communities. And as of yet, we really don't know what the health impact of that corridor is. So we're trying to bridge that gap and figure out what that is. To give you a breakdown, so these neighborhoods in the city of Cleveland where the Opportunity Corridor runs have some of the highest levels of poverty, have some of the highest areas of, again, Black predominant populations, and also have some of the highest rates of asthma. Ohio has some of the biggest asthma mortality disparities in the country. If you are Black in Cleveland, you are 9 times more likely to die of asthma than if you're white. And these neighborhoods bear the vast majority of that disparity. We see high rates of asthma here. So the concern is that, again, traffic-related air pollution exposure may worsen those disparities in ways we don't really understand. And so our goal is to basically use satellite data, again, recognizing we have no monitors, to look at what's changed, both in PM2.5 and nitrogen dioxide across these neighborhoods, really surrounding this Opportunity Corridor, and then look at asthma-related outcomes and temporal trends around these census blocks to both measure exposure, quantify exposure, see what's changed, and then look at how that impacts health. And so that's actually ongoing right now. Monica Harkey, I think it's online, is helping with that. But these are 2 examples of really how we can use satellite data to work really at the community level to engage in EJ and move things forward. And with that, I'll pause on time and take any questions. Well, not, sorry.
Great. We'll have time for questions at the end. But next up is Sheryl, Colorado State University, and one of our HAQAST teams and Tiger teams.
Thanks, Chris. Good afternoon, everyone. Thanks for the invitation to speak. I'll be reporting out from our previously funded HAQAST Tiger team focused on agricultural and landscape fires. We are pivoting from our Kansas study that we presented at the last couple of HAQAST meetings and moving on to Florida. So just a quick roadmap about thinking about air pollution epidemiology, and we'll run through this study very quickly. So just a prelude. I'm trained as an air pollution epidemiologist. My training is from urban cities focused on asthma, as Maeve had mentioned. And this is how we think about traffic-related air pollution as related to respiratory health outcomes. We have predictable PM2.5 patterns of exposure over space and time, and that we also have a consistent set of exposure assessment tools, and that's based in the community. We have geographic information systems, fixed site monitors, dispersion models, land use regression, satellite data, and moving more into personal monitors as we kind of have those get lower cost. And we have a lot of flexibility in how we do our epidemiology. We can do prospective studies, we can do time series studies, and we can do natural experiments based on policy changes and disasters. So here we have consistent, predictable exposure assessment that leads to etiologic understanding of exposures and how they relate to outcomes. And we know, as Maeve and Qian mentioned, that we know from traffic-related air pollution studies, specifically in urban areas, that these are socially patterned exposures and outcomes, with lower SES and lower resource communities being not only exposed to disproportionate burden of air pollution, but higher health adverse health outcomes as well. So wildfire smoke changes this dynamic a little bit and puts air pollution epidemiology on its head. So first of all, we have unpredictable PM2.5 patterns exposure, not only over space, but over time as well. And we have variability in our exposure assessment tools. And this is a great conference to talk about all the tools that we have for that. One of our major challenges, though, is in the epidemiologic study design. So most of us that do this work rely on retrospective studies, including time series and case crossover studies. There are some prospective studies looking at what happens when you're exposed to wildfire smoke, what happens in the future. There's some lovely studies from Montana, from Ava Orr and Aaron Languth, but this requires rapid response at a currently limited spatial extent. And what we have here with wildfire smoke is variable, unpredictable nature of smoke, and it requires some creativity for health assessment. So now we're going to talk about smoke from agricultural burns and specifically landscape fires. So here we have unpredictable PM2.5 patterns, exposure over space, but we have more predictable patterns of exposure over time, given the seasonality of some of these burns. Again, we have some limitations in exposure assessment that we've talked about throughout this conference, and there's some considerations of epidemiologic study designs. One that we've, Reshvati Nathan worked on with folks from Emory and Georgia Tech, found increases in asthma ED visits during burn days in Kansas. The exposure assessment was fairly non-traditional. They still found a strong signal for asthma ED visits. So here for agricultural burns, we have spatial variation, but annual consistency. So here's an idea. Can we use agricultural burns as a bridge to understand some aspects of racial disparities and ethnic disparities, socioeconomic disparities that we look at from traffic-related air pollution, but also bringing in that biomass exposure that we get from wildfire smoke. And here's a slide that I think really hits home. This is from Chris Tessum and his colleagues looking at air pollution and race ethnicity, broken down by white, people of color, Black, Hispanic, and Asian. So the red represents more disparities in exposure. The blue represents advantages in exposure. And the lower graphs, the lower figures, look at these exposure by sector, by source. So we see that mostly for Black populations, they have disadvantage in every single sector that produces PM2.5. That changes slightly depending on what group you are. But overall, we know that people of color experience a disproportionate burden of PM2.5 exposure in this country, irrespective of what is producing that PM2.5. So shifting to Florida and our work in the Everglades Agricultural Region, we wanted to understand if there are sociodemographic disparities in exposure to smoke from agricultural fires. So I'm going to run this. Is it running? Nope. this. No, I'm not. Ooh, I shouldn't have done that. I'm sorry. Bad presenter. So if we can't see it, that is a Bonnie Ford special, a gift showing the HMS plumes that are over the Everglades Agricultural Region for this past year when we were out in the field. I am so sorry. Sorry for everyone online also. Chris, you're going to give me 2 extra minutes, right? I should practice. All right. There's a little. So there's a little play button here and it's not playing. It just shows a nice. Well, in case this doesn't run, it's just showing basically the area of fires in the Everglades Agricultural Region and the smoke plumes that come from those fires using the NOAA HMS system. It's pretty cool, but we can skip it if it's not working. That's just fine. Moving on. Oh, now it's going. So this is 2022, 2023 fires. So you can see that Florida not only experiences fires that are local to the Everglades Agricultural Region, but also long-range transport from fires in other places in the US. So what do we do here? So using demographic data and the statistical methods, we collected sociodemographic data at the census tract level for the 4-county Everglades Agricultural Region. That's Palm Beach County, Hendry, Martin, and Glades County, obtained from the American Community Survey. We had major categories. We were trying to look at social disparities and health disparities, including race, ethnicity, markers of socioeconomic status, markers of acculturation. And we used quasi-Poisson regression to evaluate the count of smoke plumes that intersected with each of the census tracts. There are about 418 in our area, to understand what factors were most strongly correlated with the count of smoke plumes in the Everglades region. And we used the least absolute shrinkage and selection operator, or LASSO, to implement variable selection and model building. This is a cool tool. Unfortunately, it doesn't like when variables are highly correlated. So we did some pre-cleaning before to understand if variables were highly correlated, about 0.9. We kicked those out of the model to actually have high explanatory value and do a predictive model of what was related to the count of smoke plumes. So this is some of our outcomes. This is for the 2016 to 2020 time period. Again, that fits well with 5-year ACS estimates. It was also pre-COVID. So we wanted to account for potential shifts in demographics before the pandemic happened. So median number of smoke plumes per census tract were 36, but that over the 5-year period, that ranged from 24 to 309 when the smoke plumes were intersecting with the census tracts. The number of no smoke days was significantly higher, and we had some total smoke days with transported smoke as well. But here we're just focusing on local smoke and local fires. So this is the Poisson regression. And for those of you who do these types of regressions, this model is tricky and it's really annoying to try to understand, but because it's a log count model. So what we're looking at is a incidence rate ratio. And I wrote these out so not only you can understand them, but I can explain them as well. So table 2 includes all of our model estimates. If you if you exponentiate them, I also increase them by a factor of 10. That's how we got our results of interest. So for example, a 10% increase in the census tract population with less than a high school education was associated with a 24% increase in census tract smoke days. Okay. A 10% increase in population who are not US citizens was associated with a 76% decrease in the count of census tract smoke days. And a 10% increase in households with no vehicle, marker for poverty, was associated with a 15% increase in census tract smoke days. Interestingly, race and ethnicity was not selected by LASSO, and that's not because it's not significant. It's, again, these covariates gave the strongest predictive value to understand the number of counts of smoke days in each of the census tracts. So some food for thought. SES and race ethnicity are not the same. And sometimes we have different markers that really we try to understand what is the best predictor of the outcome. And there's no one way to measure SES. So here at less than high school education was something that was strongly related to the count of smoke days and the smoke exposure in the study area. I'm showing here a figure that is very similar to our outcomes, totally different study. This is looking at health impact assessment of potential closure of 2 coal-fired power plants on the Southern Front Range in Colorado. But what we're also seeing in this study is that ethnicity and race did not explain the potential benefits of closing the coal-fired power plants and who would benefit from those closures, but education did. So again, we have to be, I think, very selective in understanding what markers of SES we can potentially think about when we're explaining environmental justice and health disparities. So speaking of environmental justice, Qian did a beautiful job of explaining the EPA definition and thinking about environmental justice is not only that disproportionate burden, but the involvement in communities in decision-making and policy. And here, this is an article from the Palm Beach Post that came out a couple of weeks ago, where it's pointed out that when there was long-range transport from smoke from Canadian wildfires in Florida, the public health department issued a warning to residents. However, there is no warning to residents of the Everglades Agricultural Area when local fires are set to burn sugarcane. And the full article can be read at the Palm Beach Post. So just wanted to talk a little bit about next steps. So we were very, very fortunate in the Tiger team to collaborate with researchers from Florida Atlantic University and local community partners to do our campaign, which we'll hear about at the next HAQAST meeting. But Lisa Weesey, who is our PI in this study, is a nursing professor in gerontology focused on Alzheimer's disease and related dementias. So Jeff, Olivia, and I are co-Is on this grant, which Lisa was awarded, to understand the impacts of the sugarcane burning, as well as built environmental factors and social disparities on Alzheimer's research and related dementias. So I do want to point out that Lisa's work, her preliminary work to fund this, could not have been possible without community partnerships. And I'm really excited that one of the community advocates and partners is here today to present her data. So again, thanks for your time. Just a shout out to all the people that make this project go, especially Bonnie Kellen and Bonnie Young. And I'm really excited for our next presentation. Thanks so much.
Thanks, Sheryl. That really set up well, as you are saying. Our next speaker and final speaker, then we'll have time for questions. Annie Ifill from the Healthier Glades Palm Health Foundation. Thank you and welcome.
Good afternoon, everyone. We'll get started in a second. So first of all, thanks to Sheryl for inviting me to come out. I am one of those community partners that are going to be working with FAU with that $4.5 million grant. I'm going to give you today a humanistic perspective to environmental exposures, as I am a resident of the community that is exposed to sugarcane burning. So we're going to talk a little bit about this. I'm not a scientist, I'm not a research person, but I do understand community engagement. And you can't do this work without having some type of community engagement, because if the community is not bought in, nothing you do will happen. So I'll wait till she gets started. That's okay. So we'll go ahead and get started. Wanted to show you this picture. So for those who are not familiar with Florida, when you think of, I grew up in Palm Beach County. So when people think of Palm Beach County, they think of Boca Raton, Jupiter, West Palm Beach, the Palm Beaches. But if you go 40 miles west, there's a large agricultural community. And so what I'm showing you here is off of Lake Okeechobee. So there are 4 communities that fall on the southern part of Lake Okeechobee. That's Canal Point, Pahokee, Belglade, where I grew up, and South Bay. And so what you're seeing here is a picture of a campground that's right in Belglade on Lake Okeechobee. And so I wanted to show you this because sometimes people get a wrong interpretation of the glades, as we affectionately call it. So I wanted to show you that there's more to the glades than what people think. Okay. So I just want to give you a quick overview in terms of what we're going to discuss, and I'll be brief because I'm anticipating that there'll be some questions. So we're going to talk a little bit about the glades, as I just briefly talked about, talk about some community health challenges that we deal with out there in the community, and then talk about some of the local efforts with our community partners and what we're doing to try to address community health, and then talk about what the next steps are. Oh, let me go back. Okay, so a picture is worth 1,000 words. So what you see here is where you see the little Walgreens, that's Belgrade. So if you look to the north, the south, the east, and the west, we are surrounded by acres and acres of agriculture. So as Sheryl talked about the Everglades Agricultural Area, this is it. So what you see here for 6 months out the year, those fields you see are you'll see sugar cane. We harvest sugar cane through burning. So if you live on the west, the south, the north, or the east, you are exposed 6 months out the year to cane burning. Now, they also produce corn, lettuce, radishes, celery, as well, but the largest agriculture is sugarcane. So when people come out 40 miles west to the Glades, they're amazed by all this field. But imagine living out in this community for 6 months out the year, from October to April, and you're surrounded by sugarcane burning 6 months out the year. So what happens is we call what we call this black snow. So this is an example of how the cane is harvested. And so as you see those particles going up in the air, the black snow, the ash, they come down on our houses in our communities. So when we're dealing with this, we have to look at how can we protect ourselves, because this is a large industry. And a lot of our residents do work in the industry, but over the years, that has changed. We have less and less residents working in industries, and they're starting to bring back folks from other countries to come and harvest the fields. I can say personally, I am a daughter of a cane cutter. My father migrated here from Barbados and was working for U.S. Sugar for over 40 plus years. So I'm not just saying it as a community. I grew up in it. I lived in it. I've been exposed to it. So this is something that we deal with all the time. And so when we talk about this, we have to be very careful, because we have a large industry that oversees those acres and acres of land. And so we have to be very mindful in terms of what we say and how we do it. Even with me being here today, I have to be mindful of what I say and what I do. And that sounds crazy, but it's the truth. So when we talk about environmental considerations, for many of our residents, as I said, we live in Palm Beach County. That's the third largest county in the state of Florida, and one of the most expensive counties, because we have not only those Boca, Jupiter, and all that, we also have the Palm Beach snow. Okay, say if my house is here, where that screen is, field right there. So when we look at it being so close to residential communities, but keep in mind, we can't afford to go to West Palm because it's too expensive. So for many of our residents, we have to go in places where we can afford. And sometimes it's those areas that don't have the best conditions. And I'm saying this, and I'm from the community. So when I wanted to give you two articles that you can look at your leisure, but what is happening right now, we're seeing more and more interest in people trying to understand about air quality. And it is making folks very anxious, but it's also bringing some attention that's been long overdue. Now, when we talk about health, the health part, there is a connection, because think about if you're harvesting, if you're doing agriculture and you're harvesting either celery, lettuce, cane, whatever, what have you, you have to use pesticides, right? You gotta do what you need to do to protect your fields so they can be harvested. But think about sugarcane. When you burn the fields, whatever the pesticides is on the fields, when they burn, it goes up in the air. So you got that as well to take in consideration. So when we start looking at in 2022, and I'm showing this here, this is our local hospital. They did, along with the Florida Department of Health, they conducted a community needs assessment. So we started to take a look and see what kind of health conditions that we're seeing as a result of the environmental factors. So we started looking at diabetes, hypertension, cancer, and then now we're looking at the Alzheimer's, because we were not looking at that before. But we're starting to see an increase actually more in Alzheimer's and cancer now in our community. And we do have issues with asthma. Trust me that we do have issues with asthma in our communities as well. Now, let me tell you about some of the local efforts. As Sheryl said, I'm the director for Healthier Glades. Palm Health Foundation invested $1 million into 6 communities throughout Palm Beach County to address issues on ways to improve health outcomes. But they didn't want to direct the community what they wanted to do. They wanted the community to tell us what they wanted to do. So about 6 years ago, they wanted to focus on behavioral health. And I thought it was interesting because when you look at small rural communities, they're very protective and guarded. And I was very surprised that they talked about behavioral health. But one of the things we were looking at is what behaviors are we doing that's affecting our overall health and wellness, both physically, mentally, and spiritually. And so with that, I got introduced to Dr. Lisa Wiese, who was already in our community at the time. And she recruited several residents from our community to work with her on doing education and advocacy and screening around brain health. And so we kind of connected together, and through this collaboration, we have been able to do a lot of collaborative partnerships with health screenings through the churches. We've done some other things in regards to education and awareness. We've brought in dollars into our community to do more research, so that way we can get a better understanding of what are the things that we're seeing that we can address now, whether it's through health screening, whether it's through education, whatever, what have you. So this has been a great collaboration and partnership for us, because on my end, my job is to work with the community. So I have to be that trusted voice and make sure that whatever is coming in our community is not doing harm, but it's also providing education, awareness, and support. So this collaboration has been very great for us. We will be working with them on the new grant. So right now, just to give you some updates, and I'll wrap this up. As you saw in the previous slide with Sheryl, she showed about the $4.2 million grant. And you saw that field of cane burning. So right now, we already know that we have the industry taking a very close look at that grant, because they want to protect their interests. They want to make sure that whatever we're doing is not going to damage their name. I get it. But we also got to look at overall health and wellness of the community, because a lot of, I'm saying this and I'm from there. A lot of folks that work for the industry don't live in the community. They don't. They either live in Broward, because where some of the industry, you go down to US 27, you're down to Broward by Weston, or you can go east. I was telling some of the folks earlier today that there is an ordinance that if the wind is blowing east towards West Palm, Boca, that area, they cannot burn that day. So they can only burn west, south, and north. And that's been on the books for years. And when I tell people like, oh my God, but yeah. So we right now, on a positive note, I'm pleased to see that we do have some local residents that is sounding the alarm and is challenging our industry to work with the community and try to work towards green harvesting. And there are some green harvesting that's happening, but we would love to see more, particularly around where you got a lot of residential areas. Because like I said, my house could be here, the field could be right there. And so when we talk about next steps, constantly looking for grants to support some of this work. The relationship that we have with FAU is huge. And then one of the things we're going to try to do is continue to do training and outreach and community education, and also continue our health screening efforts. And so with that, I know we're going to do questions and answers, but I would like to thank you for listening to me today.
Thanks, folks. I will ask everyone to come up for a bit. To be honest, I know I'm running a bit behind, but I will maybe take the chair's prerogative to ask for a few more minutes of your time to at least have our panelists hear your questions. And overall, obviously, a pretty awesome session, in my opinion. So as per normal, I'll ask you to speak into the microphone for the people who are also online. So, questions?
Hello, my name is Jesse Marquez. I'm the founder of an environmental justice organization in the Los Angeles Harbor, Coalition for a Safe Environment. And it's not a question. It is a point of clarification. You saw the definition of environmental justice. An environmental justice organization is founded by members of the community and operated by founders of that community, and their leaders and members are from that community. So in any research you're going to do, I implore that you ask the question, are you a community-based environmental justice organization? It's a yes and no answer, because what's happened in the last 5 to 7 years, organizations that are not in justice became aware of money from foundations and government agencies for environmental justice projects. So they masquerade as a environmental justice organization or representing when it was only for their own survival, and they have no membership. They are taking advantage of that opportunity. And yes, there are environmental justice organizations in practically every community in every state that are legitimate. So when you do your outreach, please do homework as to find out which are the organizations in that community, that county, that city, whatever it is, so that you know what you're doing is of the utmost benefit. And yes, they will all welcome you with open arms and do everything to support you and back you up and work with you as a team member. Thank you.
Yes, having environmental justice folks advocating for the community, you know, they take a huge sacrifice, because sometimes the community may not be ready, or they're too afraid to step up because they're afraid of what the repercussions are going to be. And so sometimes we get the people ask, well, if the community is not fighting for it, why are we fighting for it? But here's the thing, you're not understanding the day-to-day of how folks are living and taking care of their families. And so we have to remind ourselves of that human factor when we start looking at trying to address issues in a way that there's no backlash. And so as a resident of the community, I'm keenly aware of some of the environmental issues that we face. And even though today we talked about air quality, we haven't talked about water quality with the runoff of the stuff going into the canals and the estuaries, you know, and we sit on the largest man-made lake of Lake Okeechobee. That lake serves a lot of communities in Palm Beach County. And so we've been dealing with the algae blooms lately, and people like, we don't want that in our communities, but you're not addressing the root causes. So you have to address some of those things as well. So when I say this to say, I have to be mindful of where the residents are, because you can't force stuff on people. And you also have to look at what impact it will have. Because say, for example, I'm married to someone who works for the industry, but I know that the industry is not doing right by the community. But if I go at making noise, if you will, what impact does that have on my family and my household? So yeah, so folks have to weigh all those options.
I was just gonna say, I completely agree. I think one really important thing is also thinking about budget. Again, this takes a lot of time and a lot of money. And a lot of these organizations are working on a shoestring. So as researchers, I think it's really important to budget for your community partner and support them properly.
Hi, everybody. I'm Phil Wilson, and I have a question that most of you probably won't want to answer, but to spark some thought in the room. If the millions or possibly tens of millions of dollars that have been spent to re-establish the impacts of these environmental injustices on communities of color was focused on mitigating the impact, as opposed to three of the four panelists said, oh, if you're Black, you're 9 times more likely to die from asthma. You grew up in a community where people were breathing it in. If we focus that money on mitigation as opposed to reproving that being brown means you're more likely to be impacted by environmental injustice, what might that look like? And again, three of the four of you live on research dollars, so I understand that that's a hard thing to come to terms with. It's like, instead of you researching, let's spend the money in the community. But what I think right now in this country, we're at a point of doing that. So I'm just opening the floor for some blue sky thinking on how that might look.
So thanks for that question. And I'm happy to engage with that question. And there's several times a day where I'm like, we're doing this, we're answering the same question again and again. How many more studies do we need to say that people of color have worse environmental outcomes? People with low resource communities need to have worse health outcomes and higher exposures. And my hope for my job is that one day I can stop doing this and just teach kids how to program and have fun learning to code. My hope is that because the social, and Qian mentioned this, the social disparities and environmental disparities in this country go hand in hand. But for environmental health disparities, we have mechanisms to correct those disparities. I'm not saying all those mechanisms are effective, but we have EPA, we have state and local health departments that have regulations where the science can actually translate to something meaningful. We have criteria pollutants, we have standards for toxics, we have water quality standards. And my hope as an environmental health scholar is that if we keep doing this, like the hope that it'll just keep getting better, that we'll, we don't know safe exposure. There is no safe exposure to lead. We don't think that there's a threshold effect for PM. And we keep having to push that to make sure that our regulatory agencies get the picture. But I agree with you. Academicians do not need to keep telling the story again. I think what we need is to be solutions oriented. How do we work with communities on that environmental justice impact where the community is actually involved, where the community can work together to say these solutions work for us and are equitable and fair, and like Annie had mentioned, are not giving people fear about their jobs, their livelihood, their households, their family. And we are not there as a society. I mean, we are so fractured right now. But my hope for what this study is, or these studies can do, is that we do not have the same policy levers for social disparities. And some might argue that our policies for racial and ethnic disparities actually make things worse in the United States than better. So I'm sticking with environment in the hopes that we can actually have evidence-based policies, but evidence-based solutions as well. But I hear what you're saying. I agree 100%.
To second that fully, I completely agree. It's frustrating to say the same thing over and over again. We have this data. I think one major next step is thinking about sources and really community level remediation, because like you said, policy is happening, but policy happens really, really slowly, and it's not equitable. The reality is that even the policies we have don't get enforced equitably. And so engaging with communities, really thinking about what's actually going to work. Yeah, purifiers are great. If you can't afford power, they don't do anything. And so thinking about really how we can actually meet communities where they're at and find like actually communicated problems, which is challenging. But I agree, it needs to happen.
And last thing I'll say on this is what we're starting to see too is as a result of COVID, we're starting to see more and more people having to relocate because of economic challenges. And so what's happening is, I could say for my communities, is we're starting to see an increase in folks leaving from urban to come to rural. And so when they come into our communities and now they're coming in during the season, they're shocked and not understanding like, wait, this goes on, you know, that kind of thing. And so it's going to force some folks to have to address some of these issues. But we're at a point now, we know what it is. We got to stop talking about it. We got to be about it. And so right now, our communities are like, stop talking, let's do. And so we're at a point now, let's do. And I think our younger generation is going to be the one that's going to push that charge. Our time is up. We had a chance. It's the young people is what's going to push this to the next level.
So I'll just add that I think one of the things that's really refreshing for me by being part of the HAQAST is really being able to be exposed to comments like this and being able to work with stakeholders compared to, you know, some of the other research projects funding I got from other federal agencies is really just about publishing more papers and staying in the academic, you know, tower and not really have the opportunity to look at the real world situation. And I think that's a unique advantage of HAQAST and of this Tiger team, where the focus is really not about publishing yet another paper, but really about learning about the needs from stakeholders. And those are stakeholders who are working on the ground with the community members, and they're really, you know, trying to put their voice into this picture. And by learning about their needs, by, you know, meeting their needs is how I see as a researcher that I may have a little bit more impact on those things than just publishing another paper. So
I'm getting the hook. I apologize, but so certainly, obviously, like hopefully something to chew on, something to spark more conversations in this room after this session. But I will turn it over to